Uh, I believe this is the last session, and since last almost 3 hours now, you have been listening to what professionals were talking to you rather. And as a consumer, being a person with spinal cord injury, what is the perspective which I would like our professional friends to take care of? Would like to present that. So you see, today I was just wondering if it was a competitive session. I'm sure almost everybody would have won the first prize rather. Those presentations were really informative, though there was a bit of repetitions, but that has to be there. But what I would like to say is, you see, you have to understand that spinal cord injury is happening in very young people. I have put it 15 to 40 years. That is the age group. Most of the injuries are happening, we all know, and we can very well imagine how important it is that this issue is being addressed. Because that's the age which is your most productive part of your life, be it on any front rather, be it job, be it family, everything for that matter. And all things are interrelated. When we talk of quality of life, it has to be in every sphere of life rather. So as I said, with longer expectations following SCI, because now with better medical facilities, the age has almost as with any normal people. I'm touching 60 now, so you can well imagine 38 years with a quadriplegic. So it is almost at the same level as common public rather. So now the focus should be more towards quality of life, which is happening rather, I would say. And to achieve this goal, sexuality is, when we speak of quality of life, I would say people may have other ideas, but my thing is sexuality is the most important issue. I will even go to the height of saying everything revolves around that. You may say physical independence and everything, but I'm telling you, till this particular issue, I have been, my injuries now, as I said, 38 years now, and I have interacted with nothing less than 10,000, 15,000 people, if not more. And I can tell you that most of them, whenever they got a chance in little privacy, that was the first question. Usually, as we talked since morning, when they were coming with the family or with other relatives or things, they may not ask those questions. But the moment so that's why during my peer counseling session, I see to it that I have a private audience with them, at least for one session. So that they come up with, and if they are not, I will start initiating upon the issue. I'll talk of little bladder and bowel and tell them the same roots go to those organs also and things like that, and initiate upon the topic, which is very, very important, because in our country or even in most of the developing places, we have talked about that. I'll just come to that. So sexual adjustment is influenced by factors such as age at the time of injury, quality of social support, physical health, gender and severity of the injury. This we have been talking since morning. So for satisfying sexual adjustment, this is very important. SCI person will have to learn their new sexual abilities rather than recapturing the past. This is very important in our counseling session, that how do we tailor-make sessions as per their background. You see, before initiating upon the topic, we must take full biodata of that person. Biodata in the sense age, his economic background, his cultural background, his hobbies, what he was liking before injury, and then start with the things rather. So that once you have that background with you, you will be able to do a better job rather, because every individual is different. So just whatever we learn today, I always say there is so much on the shop, so much to offer, but how to bring those persons with spinal cord injury to that shop to to that resource. That is very important rather. And you see, these are very common questions which are there in the minds of people with spinal cord injuries. Only thing is, I'm just wondering whether we really address those questions. And you'll be surprised to see this slide. I have marked the years. You may say it's a study of 75, it's a study of 1981, 1984, and you can well see the figures. 65% of SCI persons never discuss their sexuality concerns. So it is it's our responsibility, it's our moral responsibility as a professional working with people with spinal cord injuries that we initiate upon this issue, we address this issue. 50% would like to have talked with the healthcare professionals about sex before discharge from the hospital. These are studies which really prove, and see 90% wanted sexual counseling if it were made available. And as I said, you may say these studies were 30 years, 40 years back. Just see the scenario, what is at the present. Even up till now, things are more or less same. You can still considered a taboo. We have been talking since morning. It is still there. So it is, as I said, it's our response. 61% received no information about sexuality. Imagine that. I'll tell you, when I was admitted in hospital for my, in the injury time, that urologist never ever talked to me. I was 21, 22. I stayed in the hospital for almost 3 years. So you can well imagine up till 24 years of age I was there. And not even a single session was given to me by the urologist or any other treating surgeon. Or after years of that, I happened to meet that urologist in one of the conferences. And I asked him, what for you are here? When you do not practice what you preach, what's the point that you are giving such a wonderful lecture here in the talk? It was in the India International Center. And he was shocked to hear that. I said, when I needed this issue to be addressed, you never ever talked to me. So that is the height, but I can say it was long back, but still. And I knew he was talking to other people, but he never addressed the issue with me. Even now, I won't say, but I must say that, even now people say 15 years, 16 years, youngster, what should we talk to him? Have a heart. If you do not address the issue now, when will you do that? It's really surprising. I'll just go to the next slide. Okay, this is, we all know. Now this is what I would like to speak. When to begin sexuality counseling. So most of the time we say the first point which I have mentioned, persons has reached a stage of reasonable psychological equanimity with his or her physical condition. That is what we normally do, and we put this thing for the last most of the times. And I have had experience when the patient came on the day when he was about to discharge or on the day of discharge. And I simply asked him, if I was not here today or I was on leave, what would have happened? So I must request and ask all my friends that timely referral should be there on those issues. Don't ever on your own decide what is the right time to refer and things. We will, because once we talk to him, and if we feel he's not in the right frame of mind, we'll definitely start in a very low esteem, and then we'll come to the things like that. Second thing is never too early after we have been talking that people from second day, third day they start. Imagine people who had injuries, who were going for a honeymoon and they had injury on the way. Back from honeymoon they had injuries rather. They were about to get married. They were just married. Imagine for them it is a very, very major issue. For them rather it is the issue, the only issue. And how can we think that he is not stabilized or we haven't removed the stitches even, or we will wait for a little more, let his bladder start behaving, let our urodynamics be over. This is not what I would say. And must before discharge is what I would like to say, because you see, in our developing countries, the patient will hardly get one opportunity to be at the hospital. It is very difficult that he'll come for a second time. Even if he comes, he'll come with so many serious complications. And that won't be the right time to address the issue. If at the time of discharge we do not address upon the issue, give him information, tell them about in detail, once they go back and they try out something, it can be really, really dangerous. I'll tell you, there was an incomplete injury case. He was a wrestler and he started walking, slowly holding the ball, and it was more or less decided that within 2 weeks, 3 weeks time, he'll be just. And his wife had come to meet him and they might have tried something, and he failed because nobody counseled him. And imagine after 3 days he landed up in the psychiatric ward. So you can well imagine how serious the problems can be. That's why I said it's good that we have talked so much, we know so much, but that must be really put into practice. We must do that. In international conferences, in conferences like that, we talk so much, but when we go back, we don't even do 25%, 30%. I'm saying in front of you all rather. So that is not correct, I would say. We must do that. And second thing is, who should be initiating? It can be anybody, as everybody agreed to that. Whom does the patient feel most comfortable with? Here you see anybody with, but peer counselor will be a good person to do those because people relate with him more. They are more open with him. So maybe the initial counseling can be with peer counselor. And rest of the medication and other parts can be taken care of by the urologist or senior doctors, whoever is andrologist is working in that field. But one thing I must mention, that each of these team members who are part of the comprehensive team must have knowledge on the sexuality after spinal cord injury. What Divya mentioned in his talk about those erections. You see, reflexic erections are involuntary. You do not have a control over them. So if the nurse or the therapist doesn't have that idea, doesn't have that knowledge or information, that these are involuntary erections. Now, problem with patients is also the same. When they get erections, they feel everything is fine. And they don't talk to you because they feel everything is fine, which is not the correct thing. So it is very important that staff must have the knowledge so that there is no misunderstanding, as it can happen anytime. And secondly, the patient also gets the full information how these erections, as everybody mentioned, will need to be enhanced with medication and other things. So it's very, very important that each of us has basic knowledge of what happens after spinal cord injury on the sexual and sexuality front. You see, the topic which I'm handling is what should be done initially. In the initial stage, thing is to prepare that person, to show him the possibilities. Yes, there is a life. Yes, there is a sexual life possible. And that can be done in so many words. Because the moment you really spend quality time with the person, give them examples, make them meet people who are leading a good sexuality life, it can really bring that change in them. And there has to be so as I said, almost every patient in that age group, 15 to 60 years, must be referred for sexuality counseling. Must be referred for sexuality counseling. Second is sexuality counselor. You see, sexuality counselor can be anyone from the team members which I just talked about. But I would prefer a nurse, a male nurse and a female nurse would be a better person, if not at least a peer counselor. But even peer counselor need to have good knowledge about physiology, anatomy, the psychological adjustment and everything. Then only that person can really, and somebody who is really well rehabilitated and leading a good sexual life. Only then you qualify to be a sexuality counselor for persons with disability. But as I said, it can be any of the members of the team, and there should be communication among the team members. Wherever you come across a hurdle, send him to another person. I at times feel the person is not ready. I'll ask the peer to have a word and bring him to that stage that where I can touch upon the issue. Or whenever she feels, she comes. Even urologists refer to us that you do the initial counseling, and then I'll send them to. So that is very important, that we have a good communication among the team members. Peer counseling, as I said, all these factors are there. Basic thing is, initially, we need to give them information. We give them the correct information. Okay, this is possible, and possibilities are endless. It is matter of putting things into practice, trying, and if you really motivate somebody with correct information, with correct way of counseling, things happen. At least I never ever found problem when I counsel a person. It works. You see here, I may not like to mention, but yes, you see, some will have that, where will we find a partner? That is another in the youngsters who are unmarried, and they say, we do. I even go to the height, I said, you would try a sex worker rather. There's no harm in that. There has been too much of hue and cry about it. I said, why? I know the people who are talking about, they themselves are doing those things. And for a small cord injury, they have that notion, this can't be done for them. This is not, you have to understand they have every right. And only thing is, we must make them aware of the risk and everything. Okay, what is there? And if he or she is comfortable, I think it hardly matters. And once the person is being motivated or explained and he is ready, he must be referred to the psychologist to assess, okay, the person is ready, and then urologist must attend to them. These two things, sexuality, room with necessary tools. This is very, very important rather. You see, as I said before, the person leaves the hospital, he or she must have exposure to these things so that they practice, and if there is any problem, at least we can rectify this before they go back. Because if they try out those things, once they go back home, there can be a lot of crisis which can really create problems rather. So this is what I wanted to make. These are some of the areas which we have talked since morning. They must be covered in the initial stage itself. If you feel the person is not ready, it is our duty to make him ready. And you see, that's why this psychosocial counseling is all about. The psychologist, the social worker, the peer counselor, nurses, everybody are part of the psychosocial counseling rather. If you really address the issue in a proper way, talk to them at their level of understanding, things will definitely happen. And it is very important that we focus on this issue. And we have talked about these, focus on penetrative, participative sex for more than penetrative. We must explain them things rather. Bladder and bowel management, as we have talked since morning, is very important. Spasticity and pain, fertility issues. And you see, I was very happy to see in the slides today about the semen retrieval and things like that. But you see, in most other places I've seen, they talk of sperm retrieval rather than semen retrieval. And they just think of IVF. Nobody talks of IUI, the intrauterine insemination or IVI with the patient. Mostly it is not happening. I was in a Asia Spinal Cord Network conference in Bangladesh, and my co-speaker was a physiatrist from, I won't name her, from which place. But when I initiated upon the issue and I asked her whether in Spain you are practicing this, she said, never. We just go for IVF. Imagine, I recently was in Miami for a training for 3 days in this March, and whole 3 days they just focused on IVI and IUI. They never talked of IVF. Even one of the person was with a sexual implant. Even they showed him how with the vibrator they made him ejaculate rather. So this is something, because in developing world, especially in our countries, nobody can afford IVF after spending 5 lakhs, 10 lakhs in the hospital. People don't have money for even wheelchairs with them when they are about to leave the hospital. What to talk of IVF and thing. So they compromise with that thing. But IUI and IVI hardly cost you anything. If you really give them that thing, you can simply think of the difference which will make to their life. If you tell them that you can have a baby just by this simple method of IVI or IUI. So this is very, very important rather. You see, I always say the difference between a peer and a professional is that I can feel the thing. You people can understand them, but you can't feel the way they. So that is very important. When you start connecting with them in real sense, I can tell you it can really bring the difference. Thank you so much. And they can rejoice like that.